Have you ever been a lover of twins? Like anytime you see them, you feel so happy and joyful and wish you had yours. If you eat triplets, quadruplets, quintuplets, sextuplets, octuplets, any one of them, if you're that kind of person, you are in the right place. So in this video, I'll be giving out information about the types of twins, factors associated with giving birth to twins, the medications and procedure you have to carry out in order to achieve them, and most importantly, the signs that you are carrying a twin. So sit tight and watch, because what I'll be telling you in this video is fact. It's not something that might happen by chance. Hello subscribers, welcome to my YouTube channel. In this channel, we talk about everything regarding what? Health. If you're meeting me for the first time, my name is Christabel Iberosi. I'm a registered nurse, a registered midwife, a registered public health nurse, and a BSc in nursing science holder. So if you're interested in this video, please sit tight and watch the video. So I will start by explaining the types of twin. Although we have 6 types of twins, but in this video I'll be talking about 2 types, which is the maternal and the fraternal twin. Now, in the fraternal twin, also known as the dizygotic twins, now this type of twin occurs when 2 eggs are being released by the ovary during a single ovulation, and then 2 sperms goes ahead to fertilize it, resulting to 2 genetically distinct embryos. Now, since they come from 2 eggs and sperm, this twin will genetically look like normal sibling. Since they don't get to look alike, right? They will look differently from each other, just as similar as a regular sibling, sharing like 50% of their DNA. Since they come from different egg and sperm, their physical features will differ. It will definitely differ. And as regards to gender, they might be a boy or a girl or the same sex, but just know that their eye color, height, build, facial features, hair color, and the way they walk will definitely differ. That is why they are non-identical twin. Number 2 type of twin is maternal twin, also known as identical twin or monozygotic twin. This type of twin occurs when one fertilized egg splits into 2 during early development. And this type of twin, they share the same genetic material because they come from the same sperm and egg. The reason why this egg splits is not fully understood, but when it does, it will lead to 2 embryos that are genetically what? The same. Since this type of twin come from the same sperm and the same egg, their physical characteristics are definitely going to be the same. In terms of gender, they will be the same sex, either girl or boy or boy. For physical features, both their height, their facial features, their hair color, eye color, height, the way they walk will definitely be the same. Now, let's talk about factors that can increase your chances of having a twin. There are several factors that can increase your likelihood of giving birth to twin. Number 1 is family history. Women with the family history of twin, especially in their maternal side, have this likelihood of giving birth to twin, but particularly the fraternal twin, that is the non-identical twin, is age. Women above the age of 35 to 40 have a higher chances of giving birth to twin. Reason being that during their ovulation, they are likely to release more than 1 egg during that time. Number 3 is race and ethnicity. Do you know that women of African descent, like the West Africans, have these higher chances of giving birth to twin, whereas the women of Asian descent have a lower rate of giving birth to twin? Number 4 is number of previous pregnancies. Women who have had a lot of pregnancy in the past, most especially twin, has these higher chances of giving birth to twin. Number 5 is body type. Women who has higher BMI, or let's say taller stature, have this increased likelihood of giving birth to twin, possibly due to higher amounts of some certain reproductive hormones. Number 6 is diet. Science suggests that women who consume a lot of dairy or follow a diet high in calories have these higher chances of giving birth to twin. 7 is breastfeeding. Women who conceive during breastfeeding has a higher chances, like they have the more chances of giving birth to twin. Just note that the above mentioned factors influences your likelihood of giving birth to what? Fraternal twin, non-identical twin, as the identical twin can occur without any specific contributing factors, like it can just occur. Now, let's talk about the fertility treatment that can help you achieve twin, and these are the medications. But let me put a disclaimer. Before you take that drug, your doctors have to be aware of it. They have to monitor you and tell you how you can take that drug. It's not a drug that you can take on your own without any guidance from your healthcare or primary healthcare. There are no drugs specifically designed to conceive twin, but there are some fertility treatments or medications that can increase your likelihood of achieving twin, that is, bringing about multiple births as a side effect. Those drugs include clomiphene citrate, brand name Clomid. What this thing does is to boost ovulation and increase your chances of what? Releasing more than one egg, leading to what? Multiple births, that's or twin. Number 2 is gonadotropin. These are injectable fertility drugs that can stimulate the ovaries to release multiple eggs, thereby leading to what? Multiple births or twin. 3 is letrozole. Letrozole is another drug that sometimes being given to help women with ovulation, especially those who are experiencing infertility issues like conditions like PCOS, that's polycystic ovarian syndromes. So this type of drug now is a drug that helps to reduce the estrogen level, thereby stimulating what we call follicular stimulating what? Hormone. This is a hormone that helps the ovary to produce egg. So in this case now, this drug, what it will do now is to cause the ovary now to release more than one egg, leading to twin or multiple births. Number 4 is metformin. Although it's used in treatment of insulin resistance, like in type 2 diabetes, but this type of drug is being given to women who suffer from infertility issues, especially PCOS. But this can only increase their chances of having twin if it is taken alongside with other fertility treatments. Now, I'll be talking about the procedures for you to achieve giving birth to twin. Although there are many of them, but I'll be talking about the two common ones, which are IVF and IUI. IVF, which is in vitro fertilization, and IUI, which is intrauterine insemination. Number 1 is IVF. Now, how does this IVF increases your chances of having twin? Before IVF occurs, the woman will be given what we call ovarian stimulant, example gonadotropin, which is a fertility drug to help stimulate the ovaries to produce multiple eggs. So this will increase their likelihood of what? Having multiple pregnancy or giving birth to twins. Now, after this eggs has matured, they will carry out a procedure known as egg retrieval. That is, they retrieve the egg from the woman's what? Ovaries. And once it's been done, they will take it to the lab for fertilization to occur with a sperm. With that, an embryo, more embryos will be what? Created. After that, after this fertilization, the embryos, 1 or 2, depending on the number that the doctor wants to transfer to the uterus, maybe 1 or 2. Now, if they transfer 1 or 2 embryos to the uterus in order to increase their chances of what? Implantation. That's the reason why they stimulate the ovaries to produce multiple eggs to help in successful implantation during pregnancy. So once they collect 1 or 2 multiple embryos and then transfer it to the uterus and it implants successfully, that will increase your chances of having multiple pregnancy or twin. Number 2 is IUI, that is intrauterine insemination. This happens when a sperm is inserted directly into the uterus to facilitate what? Fertilization, alongside with some fertility drugs like Clomid or gonadotropin them. So when the woman takes all these things, you know that will cause the ovaries to release multiple eggs. Then since the sperm is being transferred directly to the uterus, it will increase your chances of fertilizing more than one egg, leading towards multiple births or twin. Now let's talk about signs that you're actually carrying a twin. So some of these signs and symptoms include high increase of HCG, that is human chorionic gonadotropin. This is this hormone that you see in your urine or blood when you test for early pregnancy. So when there is higher level of this hormone, it's an indication that you are carrying a twin. Number 2 is nausea and vomiting, also known as hyperemesis gravidarum. This occurs when there is high amount of HCG, that's human chorionic gonadotropin, and estrogen level. So women who are with twin pregnancies tend to have these hormones causing them to throw up excessively than women who are carrying singleton pregnancies. Although there are some other factors that can contribute to women carrying singleton pregnancies to throw out often or much, but it is always more in a woman carrying twin pregnancy. Number 3 is enlarged abdomen. This is because the uterus is now larger than the expected gestational age. For example, you'll be at your 15th week of pregnancy, but it's looking as if you have reached your 25th week of pregnancy because your uterus is enlarged and because you are carrying more than one child. Number 4 is advanced weight gain. A woman with twin pregnancy will definitely have an increase in weight more than the average that she is supposed to have, and this is often dictated at the first and second trimester. Number 5 is excess fatigue. Due to increased metabolic demand from the two fetus, you are definitely going to experience more tiredness than when you are carrying a singleton pregnancy. Number 6 is ultrasound dictation. Early dictation of pregnancy using ultrasound will help you to know whether you're carrying more than one pregnancy. It is by far the most definitive method of knowing whether you have twin or not. If you have always wished to carry a twin, I wish you good luck in you trying. But please don't forget to write in the comment section. Come and share the good news in my comment section so that we can rejoice with you. If you really enjoyed my video, do what to give it a huge thumbs up. Subscribe, comment on the comment section. I will definitely respond. And most importantly, turn on the notification bell to get more health topic and content from me. Until next time.